I always thought of every time I have a patient interaction, I have the chance to make, or the opportunity to make a difference in that patient's life. So victims of violence, when they come into the emergency department, it's often taught that it's kind of a reachable moment, also a teachable moment to say, hey, you were just shot or stabbed or beat up. Let's not continue that cycle of violence. We can make a difference right here, right now. And I think that with this program, it's helped expedite just the work that I do by myself. Every patient that I see, trying to think myself, what can I do to make them a better person, to make them a better place? And that's what we see in our community is that usually there's one event that occurs where someone's shot and there's retaliation. So in the emergency department, we're going to try to stop that cycle, try to stop people from getting so upset when somebody does something against them. And even if it's a honking of a horn or if it's a punch or a stab. So that's kind of the idea of what I think we need to do as a society, but what we're doing as our violence intervention program.
On this episode of TLC Connections, we sit down with Dr. Greg Casey, an emergency medicine physician at Mercy Fitzgerald Hospital, to discuss the Violence Intervention and Prevention Program. Dr. Casey shares how this initiative, a partnership with Trinity Health Mid-Atlantic and the Lincoln Center for Family and Youth, is working to break cycles of violence by providing critical resources, therapy, and follow-up care for victims. With a focus on treating the whole person, not just the injury, this program aims to improve the lives of individuals and strengthen communities. We hope you enjoy the episode.
Welcome to TLC Connections, the podcast where educators, counselors, coaches, and community leaders come together to inspire change, one connection at a time.
Welcome, Dr. Casey. Thanks for being here on TLC Connections today.
Thanks so much for the invitation.
I'm really excited to meet with you today. This is actually our first time meeting, which is really surprising, actually, because I know we've been partnering with you and your team at Mercy Fitz for quite some time. So I'm really excited to learn more about our partnership with you and what your work looks like in the emergency room. But I want to start our conversation by asking you if there has been any connections, choices, moments in your life that have been transformative in making you who you are today.
So honestly, I think going back to childhood, my dad used to always say, try to leave the world a better place than when you got here. Mm-hmm. And it's a thought and a saying that keeps coming back to me. And, through emergency medicine, seeing patients in the ER, I feel like I'm making a difference in the world. And then with this program, I feel like I'm really trying to make a difference in the world as well, especially the community where our hospitals are.
Wow, that's so special. I love thinking about you as a young person, hearing your dad say, leave the world a better place than you found it. That's really cool. I always loved when you go to national parks and there's the sign that's pack it in, pack it out kind of deal, leave it better than you found it. So it's kind of a nice way to think about the world.
We actually have a national parks handkerchief in the basement that I put up on the wall for the kids, pack it in, pack it out, leave it better than when you got down here. So
it's really been, that message has been intertwined into your whole life, beyond your work.
Yeah, exactly.
Love that. And you're passing those messages down to the young people in your life as well.
Hopefully. I'm trying to raise my kids to be helpers, kids that help other kids and leave the world a better place than when they got here as well.
Amazing. So not only are you positively impacting people in the hospital, but you're also making humans that will hopefully, follow your footsteps and also do great work.
Hopefully.
So I love your origin story of what brought you to wanting to be a helping professional. And I think about emergency room medicine, and it's definitely a high stress environment where it requires a lot of flexibility, a lot of needing to adapt to different situations. And so I guess I'm curious what led you down that specific route towards emergency medicine in the realm of all the different options and helping professions.
So there's multiple reasons why I think emergency medicine was the right specialty for me. Is one, I really do like to help people. I like to meet people from all different ages. I've taken care of patients from, newborn babies up to, I started a shift a couple months ago where I took care of my first two patients were 105 years old and 107 years old.
Whoa.
Which has to be some sort of record for the oldest first two patients of an ER shift.
Oh my gosh.
But I love the ability and just the opportunity to take care of sick patients and make someone's day better. Just love the environment. And I also like staying up late. I don't really mind doing the night shifts. I also like the morning shifts too, because I can get done with my day early and then come home to see my kids. but I just think I was made to be an emergency medicine doctor.
It sounds like you're so passionate about your work. That's really cool. I love hearing that. And I mean, just what an amazing display of flexibility to be thinking about serving newborn babies all the way up to people who are 105, 107. I mean, that's really impressive.
It's something I look forward to my whole life. And during college, when I was thinking about professions, I was like, I think emergency medicine is going to be the way for me. And it took a little bit getting into medical school. I didn't get in my first time, but with hard work and multiple applications, I was able to get in. And my older brother's been a mentor too, because he's an emergency medicine physician as well.
So you and your brother both working in emergency rooms, doing this really important work. And I know based on your partnership with us that you are heavily focused in gun violence intervention and prevention. So can you speak a little bit to that and where your passion around that comes from?
Yeah. So I actually have a couple interests. Like one, emergency medicine physician, but I'm also the EMS medical director. So I review a lot of the charts that come through the emergency department. And working at Mercy Fitzgerald Hospital, our EMS crews respond to a lot of violence. They take care of a lot of stabbing victims of community violence, gunshot wounds. A lot of these patients don't end up at Mercy Fitzgerald Hospital, but they go down to Penn Presbyterian Trauma Center. So in the emergency department, I would love to have a shift where I don't take care of anybody, right? I'd love to not take care of any sick old people from the nursing home or anybody who got in a car crash or any victims of violence. And through working at Hanwha Hospital when I was a resident, there was a physician there named Dr. Ted Corbin, who was kind of a mentor and someone I always looked up to. He also brought really amazing snacks every time he worked with us. But he worked in was one of the early adopters of the violence intervention program. And looking at the rates of violence in our community, I thought maybe we could do something at Mercy Fitzgerald Hospital as well. And that's when we started to explore what opportunities were there to find a partner or to start a program in our hospital. And that's what kind of led us to the partnership with the Lincoln Center.
Wow, that's really cool. I love hearing about your mentor too. I think that's one thing that we like to think about and talk about a lot on this podcast is connections that helped create a ripple effect to bring us to where we are, to really grow our passion and to help shape our lives. So you had that mentor, Ted. Do you want to say anything more about like how he impacted you?
I think it was just his personality. He was always calm in the emergency department, but always like working on both his violence intervention program as well as working as an emergency physician and blending the two careers. And I think that it's a perfect kind of symbiotic relationship to be an ER physician, plus try to like decrease violence in our communities. And I think you're making a difference in both ends, which is a great opportunity that emergency doctors can have with these programs.
Yeah. I think that's a really hard lift to think about is reducing violence in communities, right? It's a big systemic issue that is multifaceted. It has so many moving parts. And I know as someone in a helping profession, sometimes those types of large, complex issues can feel kind of helpless as someone trying to help with that. Do you ever struggle with that? Like, what's that like for you?
So it's tough because with these programs, a lot of times you don't see the benefit of a program until years down. It's like advanced statistics to see, are we actually making a difference? But I always thought of every time I have a patient interaction, I have the chance to make, or the opportunity to make a difference in that patient's life. So victims of violence, when they come into the emergency department, it's often taught that it's kind of a reachable moment, also a teachable moment to say, hey, you were just shot or stabbed or beat up. Let's not continue that cycle of violence. We can make a difference right here, right now. And I think that with this program, it's helped expedite just the work that I do by myself. Every patient that I see, trying to think to myself, what can I do to make them a better person, to make them a better place? The one, I guess, idea and something that I've talked about a lot is that if you're driving into work and somebody honks the horn at you, what are you going to do? How do you respond?
Myself, I am actually a big fan of, and this might be because I'm a therapist, I'm a clinical social worker. I tend to think about what I can control and what I can't control, and very much I'm like, they're beeping at me for whatever reason, and I'm gonna just focus on my space. And if I'm annoyed, I'm going to play a song I like, or I'm going to do some breathing. But I will say there are people in my life who get very, very angry and start cursing, and I won't call them out on the podcast because I know they will be listening. But I've certainly seen people have very strong reactions to that.
Super strong reactions. So someone honks a horn, most people, someone honks a horn at you, you honk a horn back.
Right.
And that can escalate quite quickly.
Absolutely.
And this is kind of what leads to violence, right? Is that instead of honking horns, somebody shoots at somebody. Well, someone else is going to shoot back. For every action, there's a reaction.
Right.
And it's really hard to program us and to work as people to try to figure out, how do we have something go against us in action and not respond, or respond in a positive way? And that's really tough. And that's one of the parts of the program, is working with the victims of violence once they have the initial consultation in the ED, as we get them into, therapy and try to work on their anger response. And it's really tough. And most of gun violence, I guess in the 90s, early 2000s, was the drug dealers. But now we see most of the gun violence is actually involved with alcohol. And they from different disputes, right? Two groups of people are at a bar and they're drinking and they get upset with each other, and it's tit for tat until someone pulls a gun, right?
Wow.
And then there's going to be responses from that. And that's what we see in our community, is that usually there's one event that occurs where someone's shot, and then there's retaliation. So in the emergency department, we're going to try to stop that cycle, try to stop people from getting so upset when somebody does something against them. And even if it's a honking of a horn, or if it's a punch or a stab. So that's kind of the idea of what I think we need to do as a society, but what we're doing as a violence intervention program.
Yeah, that retaliation piece is so huge. I know from some of the school district partnerships that we have, that we are often, when we are working with a community who's experiencing a lot of gun violence, it is so often retaliation based, that someone had a relationship with someone's partner and they're retaliating, or someone, someone was jumped, and then so that the other parties are going after them with a gun. And there is so much of that retaliation. And I love the approach of, we need to look at what that person who's been affected, we need to look at them and see how they're conceptualizing the event. How are they thinking about it? Are they having that instinct to just retaliate? Is that really going to stop the process? We need to help them. They need therapy. They don't need to be, punished. I think there was definitely a time where even if you were a victim of gun violence, you might have gotten a much different response in healthcare, where it's like, people might be thinking, oh, well, they were involved in something that they shouldn't have been involved in, and that's why they were shot, rather than kind of trying to meet them where they're at and understand how you can help them with some of their needs they might be having.
Exactly. When we take care of someone who's brought into our emergency department, we're not a trauma center. So a lot of times we have to transfer the patients out, but we still have that moment where we can talk to somebody and try to figure out, okay, what happened? How do we treat you medically? And how do we help support you once you're through this event, just so that it doesn't happen again? So a lot of our victims, they come through the emergency department. Our team meets them and they get transferred out, but then we get them into therapy.
That's awesome. So you mentioned you try to set them up with therapy. What does that process look like?
So that's with the grant that we have at each hospital, we have two employees of the Lincoln Center that are there. So either myself or one of them will come down to the ED to do the initial consultation, and then they enroll them in the program, talk a little bit about them, say if we don't have time to go over the whole program now, we'll give you a follow-up call and then meet with you to see if you're interested in getting therapy. They also help with if they have court dates or if they need shelter or food or clothing. A lot of times when patients come into the emergency department, one of the first things we do is we cut off all their clothes, right? Because we're looking for other wounds. Were they shot more than once? Were they stabbed more than once? What are we missing? So our team does all of those things, and it's really cool that we're able to provide that at our hospital through the grant.
Yeah, that's incredible. I mean, I love that holistic approach of saying, we need to look at all of your needs. We're going to consider your emotional needs, but it's like Maslow's hierarchy of needs, right? We need to make sure that you also have food. We need to make sure that you also have shelter. We need to make sure that your basic needs are met so that we can also address those emotional needs as well. So that's really cool.
We actually had a victim earlier this year that was shot, and his shoes were brand new white shoes, and they had blood on them. And he was really upset about it. So I was able to actually help clean his shoes off, and that made him feel better. And I was like, oh, all right, that's about all I can do. We have to send you to the trauma center, but he was in a much better mood just because of that, and someone was looking out for his needs. So obviously, not in the hierarchy, not the highest thing is clean tennis shoes, but for somebody that that matters.
Wow. Like, I don't think I've ever sat down with an emergency room physician who's like, yeah, I helped a patient clean their white shoes the other day. That's really awesome, Dr. Casey.
It's little things like that. Rob was at the hospital one day, and I helped somebody with their walker put new tennis balls on the bottom of the tennis shoes. But little things like that, little ways to have a relationship with the patient and to build their trust is one of the most important things that we can do as emergency room physicians or nurses. And then treating our patients with compassion, and not saying, why were you shot? What were you doing? But treating them as humans, that helps them, that helps the patients trust us, and it makes us be able to provide better care as well.
It definitely sounds like you have a lot of passion around the violence intervention piece. And I know there's a story that was really impactful for you. Would you be willing to share that today?
I can share some details. So I think working in the emergency department, we see a lot of stuff that we can't really talk about.
Absolutely.
A lot of things that, I don't even tell my wife, but there was an event where there was a child that was shot and killed and brought into the emergency department, and taking care of the child. I realized that the nurse had a daughter, and I had a daughter of the exact same age. And it was really tough to see. It's really tough to manage that, but it also makes you realize how fragile life is, and love your family members and your friends, even more. But from that was before we applied for the grant. And that was one of the reasons why, is because just gun violence makes a difference. It's not just impactful on the person who's shot and killed, or the person that's shot and injured, but their family members, their community, their classmates. And gun violence is it's been decreased in Philadelphia over the past couple of years, but it's still there, and it's still making a huge impact.
You're so right. It's so hard. And I think that's such an impactful experience to be in an emergency room and see a child come in like that, and have to be thinking about your own life and your own kids. And yeah, I mean, that's like nothing else, right?
Yeah, I'm sweating a little bit. It's a stressful situation, and not a lot gets me stressed out, but it was definitely.
Yeah, and you mentioned how much it affected the family members. I shared with you earlier that I worked in emergency room, in the area several years ago for many years. And there was an incident. It wasn't a gun violence incident, but there was an incident one night where there was a child who had passed. And it was sudden and unexpected. And the child was actually being discharged and ended up dying because of an allergy. And I mean, the noises that we heard from the family members, I will never forget. It was just unbelievable. It's comparable to nothing else.
We have a family room where we tell family members essentially like bad news often. And it's the worst room to enter in the emergency department. Every time I walk past it, even if nobody's in it, I get a visceral response thinking, this is like the worst room ever. And telling people on Father's Day that their fathers passed away, or on Christmas or on holidays. It's just a tough room, a tough place for emotions. But I also like my job, and I like to be able to be there for people during those times.
Yeah, I mean, those are really hard conversations, and of course, essential conversations. I think that many people in helping professions have to take or have to experience. And I know as a social worker, as the counselors that I support, all of the folks that we work with here at the Lincoln Center, we also have a lot of difficult conversations as well. And so I know something that I emphasize to my staff very frequently is self-care. And how are you taking care of yourself? Are you paying attention to what you're carrying around? And so as I hear you tell your stories, I really think about, wow, this is a lot that is coming on to you every day. That like a lot of heavy conversations and a lot of difficult stress. So I'm curious how you cope with that, what your process is.
So I think something that really helps me is being active. And we have the Peloton. I feel like I should be on a Peloton commercial, because that thing, I feel like a hamster on there on cocaine. I just get on and pedal as hard as possible. I don't listen to Matt Wilpers when he says, no, don't try to like pass, people. This is an easy ride. I try to go hard every ride, and try to do some strength workouts as well, but also getting outside and riding my mountain bike outside, walk with my dog, and then watching my kids play sports, which it's fun. It's stressful. My daughter's a hockey goalie, which is really hard to watch.
Wow. Oh my gosh. Well, that's really cool. I love that. And, you're a doctor, you understand how the body works, but I know that when we are carrying a lot of stress, one of the best ways to work that through our bodies is moving our bodies. So that's great that you have that practice.
It's definitely fun and definitely a great stress reliever. I should have ridden before I came in for a podcast. Might have been a little more relaxed, but I'll ride this afternoon.
Yeah. The other thing I'm thinking of is maybe in thinking of you having these great self-care practices, keeping yourself active and having these things in your life that mean so much to you. I guess it makes sense to me. You have such like a nice calm demeanor. And I think that's so important in these high stress environments. As counselors, as mental health professionals, we talk a lot about co-regulation and how if someone comes in and they're at a level 10, and then we are also at a level 10, no one's going to be regulated, almost kind of tracing back to beeping the horn, beeping back. So in order to be able to help someone regulate, help someone get to that calm state, we have to be in that calm state. We have to be able to model and co-regulate. And do you find that helps you in your practice in the emergency room, being calm?
Yeah, I think overall I'm a pretty calm person. I think before a very sick patient comes in, I have emergency Twizzlers in my food bag. I actually have the same cooler since residency. So it's getting old. Maybe someone bring me a new one for Christmas. But I have emergency Twizzlers, so I'll eat a piece of candy or have a little snack just to help take my edge off, decrease some of my anxiety, and add a little fuel for my brain. But being calm for the other physicians, the nurses, and the patient and their family, I think that goes a long way. Nobody wants to come in and have a really anxious ER doctor taking care of them or acting nervous. And even in the tough situations, we train for those, right? So the worst case scenario on an airway is that I have to, do a different procedure or attempt a different type of airway. And, we've trained so much with it that you can just stay calm through the whole situation, and it keeps everybody else in the room calm as well.
Yeah, that muscle memory and just doing it over and over again. And yeah, once we become stressed or escalated, our brains are not able to access those important parts that are going to help us make those important calls that require precision, right? So that's great. So one of the things I love about healthcare and hospitals is that you get to work on a multidisciplinary team, which I'm hearing you talk about, working closely with nurses, with social workers, with your team members. And so how did those connections impact you in your day-to-day work?
So I think emergency medicine is the ultimate team sport, right? And our sport is trying to make our patients better and taking care of our patients. But we have the EMS team, which is almost like special teams, right? And we have EMTs and paramedics that see the patient in the field, call in for a good report. And then our nurses greet them at the door. Sometimes we do as well. But we work with the whole team. We have great social workers, radiologists that read the scans that we order, the radiology techs. And it's such a involved team taking care of one person. I think that it's just a blessing and privilege to be kind of the leader of the team taking care of patients. And it makes a lot of fun.
You know what it makes me think of? And this might be like really obnoxious to say to a doctor who's working in emergency medicine, but it makes me think of Scrubs. Have you heard of that show or seen it?
No, I've never heard of it.
You've heard of it,
yeah,
right?
Of course.
Because like in Scrubs, I think it's like their intro, maybe it's like the doctor walking through and he's like passing a chart and the nurse takes the chart and then hands it to like the radiologist and then the next person. And I think you kind of described that. Like it's a system that needs to work really well together to be functioning. And I think a multidisciplinary team is the best kind of team, right? Because you have people with all of these amazing skill sets that complement each other really well, and they're all a little bit different. And I know when I've worked in emergency rooms, there's also something especially special about working alongside people who are seeing this very heavy stuff with you. It's almost like this, I don't know how to describe it, but it's like a comfort level for going through these difficult things together. Do you ever feel like that?
Yeah, I feel like there's this almost like a club of people that have worked in the emergency department, because most people don't understand exactly what happens in emergency departments.
Yeah.
Especially with my co-physicians that have been really great and supportive, especially when we have a bad case, because they've usually dealt with the same thing. But anybody that works in the emergency department, anybody in EMS or nursing, it's almost like a club that we kind of get each other and understand what we're going through.
That's so cool. I'm sure that probably helps with your stress management as well, right? We know that our brains love connection, our brains love relationships, and so being able to have that shared experience together is so important.
Yeah, and I think having a support network of emergency physicians is really important for me, because we finish shifts at off time. So if I finish a shift at 3 a.m., luckily I have a good friend in Hawaii. I can call him, or I have another really good friend in Washington State. Wow. So I can call them at the end of my shift. Usually nobody else is awake at 3 a.m.
Right.
But I have them that I can call or send a text, hey, are you awake? Or I have another ER friend somewhere who's doing a night shift. So we have someone to communicate with and go through kind of these stressful moments, and have that support. That's kind of an interesting support network of people that have odd hours as well.
Yeah, that's really nice to have that at your fingertips.
Yeah.
So cool. So thinking about the VIPP program and the way that it is instrumentalized in your healthcare system and the system you work in, can you speak more about the specifics so that listeners understand what that looks like?
Yeah, no problem. So initially I thought that we would just do this program at Mercy Fitzgerald Hospital, because we have two communities that have cracked the top 10 for the most dangerous communities in all of Pennsylvania, Yeadon and Darby. Not everybody in those communities is a violent criminal. In fact, most people are great and beautiful, and I love driving through both of those towns. But when we applied for the grant, we actually decided, why don't we do this for all the hospitals in Trinity Health Mid-Atlantic that are in Pennsylvania, because it's a Pennsylvania-based grant. So that was Mercy Fitzgerald Hospital, Nazareth Hospital, which was in the Northeast, and then St. Mary Medical Center, which is up in Bucks County. So at each of those hospitals, we decided to have a team, because I think it's important to have someone that you work with that you can toss ideas off of, support each other, kind of work together as a team. Sometimes two team members going into a room talking with a patient is a little less threatening than just one person. You're there to support each other. So at each hospital, we have a violence intervention specialist. Usually those are the ones that come into the ED to talk with their patients initially, but also the social worker that can follow up and follow these patients for up to a year of services, which is pretty intense. And all of our team is just have multiple degrees. They're super intelligent. They're super chill, great personalities. So they all work together. They toss ideas off of each other. Sometimes they cross cover at the different hospitals. And then we have Tyrese Mayo, who's been phenomenal. She's kind of our lead, and she basically directs the team. She goes through and helps them with chart completion, with different trainings that they do. But she's really like the glue that keeps the team together. And then we have Rob and Carrie from the Lincoln Center that really support us as well.
That's great. That's awesome. Yeah, Tyrese is wonderful. I know she's super passionate, and she actually helped me out recently. One of the schools that I support has just recently suffered a loss due to gun violence, and so she spoke to the team that I'm supervising in that district and kind of shared some of her knowledge and wisdom with them to help them understand how to support those victims. And I mean, her knowledge is really, really impressive. So yeah, that's great.
I felt like we were making the A team when we were hiring people for these different positions, because everybody's just like special and a good personality, and they're working very well together.
That's awesome.
And then hopefully the next step is that we're going to combine two of my interests in both EMS as well as the violence intervention. So after there's a victim of violence that our EMS takes to another hospital or our hospital or involved in the care, and once the patient's discharged back to the home, we're going to do community paramedicine, where the paramedic follows up with the patient in the home just to make sure that they have, they filled the prescriptions they were given when they were discharged. They know about their follow-up appointment, make sure that they get to the follow-up appointment, make sure they know how to change the dressings on their wounds. And then at the same time, we're going to have them bring our violence intervention specialist or social worker with them just to help kind of bridge the gap and maybe show them, hey, we have somebody else here that can help you heal, and have that team go out to the patients' homes in the community, which I think will be a huge opportunity for us as a program. And I don't think there's any other program in the country that's doing something quite like that.
Yeah. I mean, that's amazing. I think really, like we were talking about retaliation earlier, and what a better way to address retaliation and help do those efforts that will help prevent more gun violence down the line. And so, Dr. Casey, is there anything else that you think that we should know that you'd like to share today before we finish?
I think that just as a society, we should continue to make sure that we support these anti-violence programs, gun violence, paying for gun locks, gun safety lessons, and then also for therapy for patients that are victims of violence. And I think that hopefully, as both local, state, and federal government continues to support these programs, we can see a decrease in gun violence in our communities.
Amazing. Well, Dr. Casey, your humility, your passion, so many great things that I'm seeing from you today. It's just been an honor speaking with you and hearing your stories. So thank you so much for being here and for the amazing work that you do.
Yeah, thanks. This was a really good time.
TLC Connections is supported in part by the Lincoln Center for Family and Youth. Through education, counseling, coaching, and consulting, we empower people to make positive choices, meaningful connections, and transformational change. To learn more, visit thelincolncenter.com.